Parts of the world are starting to see the light at the end of the tunnel as their populations get vaccinated at record speed and cities such as New York and Chicago reopen after a year of lockdown. As for South Korea, it's been over 100 days since its vaccination program started and around 5.9% of its population have been fully inoculated. There's still a long way to go, but there are glimmers of hope that the worst of the pandemic is over. Today, we invite two medical doctors to ask them how to best look after ourselves before and after the jab to maximise effectiveness and to ensure that the gradual return to normalcy doesn't mean negligence of basic precautions. For this, we have Gregory Poland, Mary Lowell Leary Emeritus Professor of Medicine at the Mayo Clinic and who is also the Director of the Mayo Vaccine Research Group. We also connect with Bong-young, Associate Professor of Infectious Diseases at Hanyang University's College of Medicine. Thank you both so much for joining us. And
my pleasure.
It's lovely to have you on. And well, let's start with you, Dr. Poland. The US, where you are, it's been vaccinating its population for more than half a year now, and it looks like in some states things are finally returning to normal. So are you seeing the vaccinations effectively bring down the number of additional cases? And also, does this mean that transmissions are on the decline?
Yeah, very much so. In some of our states, we have reached levels of 70% that have been immunized. Other states, not so much. We see a difference between urban and rural areas, between communities of color and white communities. So there are differences. But that level of immunization has brought down caseloads from 50 to 70,000 cases a day to less than 5,000 cases a day in a country like ours that has about 328 million people.
So a huge improvement since the vaccinations began. And well, Dr. Kim, here in South Korea, 1/5 of the population has received their first shot of the COVID-19 vaccine, but the daily infection numbers, they haven't gone down so dramatically as in the US. When do you think the 70% of the Korean population will have immunity and cases will start to slow down?
Yeah, actually, currently 5.8% of the Korean population has completed the second shot of vaccination, and 22.8% have completed the first shot. In other words, the Korean society has yet to get enough herd immunity, and the number of daily new cases still remained as it used to be. Despite it, intensive vaccination for high-risk groups in the early phase confirmed a significant decrease in the proportion of critically ill patients and death compared to the end of last year. In addition, even though more than 100 days have passed since the vaccination began, but the vaccination was not actively carried out in the beginning due to insufficient supplies. In fact, until mid-April, the percentage of vaccinated people fell short of the global average as well as the Asian average and began to exceed the Asian average from late April. From May 27, when more than 10,000 hospitals and clinics started to participate in the national immunization program, the percentage of vaccinated people increased sharply, exceeding the world average. As shown, it has not been long enough that the proportion of vaccination coverage has increased due to the full-fledged immunization program in Korea. Now that the vaccination has begun in earnest, it is hoped that decrease in the number of confirmed people will be observed in 2 to 3 months. Since Korea has excellent experience and infrastructure in carrying out large-scale vaccination projects such as flu vaccination every year, it is expected that 70% vaccination original targeted by the government will be possibly within this year if sufficient supplies are secured.
Hopefully those supplies will be secured and that more age groups will be able to receive their shots. And well, Dr. Poland, it looks like in the US, the masks are starting to come off, and the US Centers for Disease Control and Prevention, they no longer require people to wear masks in outdoor transit spaces, and in some states, they're no longer required in some indoor areas as well. So, but then the question is, I mean, what about these new variants that are starting to emerge, though? How immune are vaccinated people against them? And also, when is the right time to get a booster shot?
Yeah, let me take them sort of in reverse order. Nobody knows when a booster shot may or may not be needed. I think we'll know that in retrospect. If we start seeing fully vaccinated people get sick enough to require hospitalization or other medical care, we'll begin to understand, is immunity wearing off and will we have to give a booster? Against the current variants, particularly the mRNA vaccines and the Johnson & Johnson vaccine, as well as the AstraZeneca vaccine, they work really well against preventing death, hospitalization, and severe disease. So, you know, while you might have asymptomatic or mild disease, you're not going to have the more severe manifestations of disease. You are right that in much of the US now, we're not wearing masks except for air travel or close travel like buses, trains, etc. Some people who are not immunized, of course, they should still wear their mask. But for those of us that are immunized and that have a healthy immune system, there's no recommendation to require a mask.
See, and well, Dr. Kim, here in South Korea, as the number of vaccinated people continue to climb, there were some reports that some pharmacies are now out of Tylenol as people seek it out to quell their headaches after they get the shot. So what are some of the common symptoms that people get, and what kind of medication actually help deal with these short-term symptoms following the jab?
Yeah, as for Pfizer vaccine, local and systemic side effects after the vaccination are relatively common, but most of them are known to be mild to moderate levels. In particular, side effects are more common after a second shot, with about 65% reported for injection site pain, about 40% for headaches and muscle pain, and about 20% for fever, chill, and joint pain. As for AstraZeneca, AstraZeneca vaccine is known to have relatively common side effects compared to Pfizer vaccine. According to the study of hospital workers in Korea, 90% complained of side effects after the first shot, with about 78% reported pain in the injection site, about 60% reported muscle pain, about 51% reported fatigue, about 57% reported headaches, and 30% reported fever. The situation is similar with the Johnson & Johnson vaccine that was recently introduced in Korea. Studies in the US have shown that systemic side effects such as fatigue, muscle pain, and headache occurred in 76% within a week of vaccination, and one or more injection site reaction in 61%. Because injection site pain, myalgia, fatigue, and headaches are major side effects, Korean Disease Control and Prevention Agency recommends taking acetaminophen, such as Tylenol, but it is also safe to take NSAIDs such as ibuprofen if these medications are not available.
Right, so muscle aches, headaches, chills they don't sound fun, but perhaps some over-the-counter prescription might help. Well, Dr. Poland, now there are still some concerns over how the vaccines have been linked to heart problems and also strong side effects in women and young adults. Are there any clues as to why?
Yes, when you're referring to women, that has been in the adenovirus vectored vaccines like Johnson & Johnson and AstraZeneca. And there we see an unusual syndrome called TTS, or thrombotic thrombocytopenia. And what happens is antibodies are made against platelet factor 4, which causes the blood to coagulate and form clots in the arteries, in the veins, and sometimes in the brain. Now, fortunately, that occurs very rarely, about 1 in 300,000 or so cases, which is certainly far less than if one were to get COVID and then suffer the risk of those side effects due to clotting. In regard to the myopericarditis or heart problems that you're referring to, we have had about 470 cases here in the U.S. in people under the age of 30. In 285 of those cases, we actually know the outcome. And 275 of those 285 are already discharged. So it tends to be very mild, tends to occur soon after getting the vaccine, tends to be in males, and tends to be in young males. Now, we have had, to my knowledge, one death in a member of our military. But other than that, this is a relatively mild and spontaneously resolving complication. There will be a big meeting of our CDC this Friday to begin to examine, are these cases occurring more commonly than we would expect just in the background? So we'll know more Friday.
Right, so it's still much safer to get the shot than take your chances. And
very much so.
Very much so. And Dr. Kim, well, in South Korea, there have been fewer cases of fatal side effects compared to the UK and some countries in the EU. But people are still cautious about the possible problems that might arise, especially with the younger age groups. What kind of symptoms then should people really watch out for? And how can people actually distinguish between the short-term and the more serious symptoms after getting the vaccine?
Yeah, as mentioned, cases of thrombosis associated with thrombocytopenia have been reported following vaccination with both AstraZeneca and Johnson & Johnson. Among approximately 34 million vaccine recipients in the UK and European Economic Area, there were 169 cases of cerebral venous sinus thrombosis and 53 cases of splenic vein thrombosis reported through safety surveillance system. Most of these events occurred within 14 days of receipt of the first dose, and in females under 60 years of age, although some cases were reported up to 24 days after vaccination, and in males and older females. Notably, severe thrombocytopenia was also observed in most cases. Recipients should be aware of the possible association and seek immediate care for signs and symptoms suggestive of thrombocytopenia, such as emergence of bruising or thrombotic complication, including shortness of breath, chest pain, lower extremity edema, persistent severe abdominal pain, etc. In such cases, some experts suggest evaluation with complete blood count and other blood tests for differential diagnosis.
And Dr. Kim, there are now concerns about whether South Koreans will be sufficiently protected against the new emerging variants of COVID-19. So what are your thoughts on this, and what kind of strategy do you think is needed to really protect the population?
Actual data on whether vaccine-induced immunity can protect against the variants are limited. Based on efficient trials and immunogenicity studies, COVID-19 vaccines likely retain efficacy against some of the variants. However, for variants with mutations found in beta variant, vaccine efficacy may be less when compared with the original wild-type virus. Overall, several vaccines were in South Africa, where the beta variant were circulating, compared with other locations where beta variant was not prevalent. There is no clear answer actually, but if mutations occur actively, mutant viruses that do not have an effect on the currently developed vaccine may appear in the near future, since mutations are more likely to occur in the course of repeated virus transmission. It is necessary for many people to be vaccinated as soon as possible to block the chance of mutating viruses.
And Dr. Poland, now what would be your top tips for someone who's just about to get the jab? How should they then prepare for the vaccination and also take care of themselves afterwards?
There's really nothing you have to do prior other than be familiar with your medical history and be able to answer the questions that are asked, just so that we can determine whether or not you have any reason to not get the vaccine. The issue is after getting the vaccine, with the first dose, as Dr. Kim noted, some people will have a sore arm, maybe low-grade fever, really nothing you have to do with it, it resolves on its own. More common are side effects after the second dose. Fever is more typical, arm pain is more typical, headache, things like that. And I think there, after, not before, but after receiving the vaccine, if you have those symptoms, certainly, and I agree with Dr. Kim, that Tylenol, also called acetaminophen, or any of the non-steroidal drugs like Aleve or Motrin can be used to relieve those symptoms. They generally resolve within 24 to 36 hours and you're fine again.
See, well, we're out of time, I'm afraid, so this is where we'll have to wrap up the interview today. But that was Gregory Poland, Mary Lo O'Leary Emeritus Professor of Medicine at the Mayo Clinic, also the Director of the Mayo Vaccine Research Group, and Bong-young Associate Professor of Infectious Diseases at Hanyang University's College of Medicine. Thank you both so much for your time today.
My pleasure.
Yeah.
And to our viewers, as always, thank you very much for watching.